My name is Marie Enger. I'm 23, and right now my primary source of income comes from cartooning.
Enger is doing what she went to college to do. She illustrates and often writes her own graphic novels. She's a freelancer, and for her, working full-time means working all the time.
Yeah, I work about 90 hours a week. If I'm not sleeping or at someone else's house, I'm drawing. There's no downtime.
And she's not complaining. Cartooning is what she loves to do. This is what she's great at. But for someone who is just starting out and working for herself, affording health care is always a concern.
Oh my gosh, yes. I have a pre-existing condition, so without health care, I can't function. I need my medication. I need to go see doctors. And if I don't have health care coverage, then I can't afford to see those doctors. If I can't see the doctors, then I can't work, and it's just this really bad cycle.
Marie is affected by mental health issues, and without insurance, her prescriptions would cost about $1,500 a month. Fortunately for her, under the Affordable Care Act, Marie is covered under her parents' insurance until her 26th birthday, bringing the cost of her prescriptions down to a mere $300.
Are you aware of options that you have?
I've seen some things on internet sources about it, but nothing super definite. And it's hard to be educated at this point because there's so many different sources and they all lean one way or the other.
While she is covered now, she is very concerned about what will happen when she turns 26.
Does having a pre-existing condition concern you that you'll get turned down for health insurance?
All the time. Yeah, I've got a big one too, so it's kind of a really scary, ugly word that while in reality, my life is great. I'm really happy. On health insurance, they're gonna see this as a really big risk for them. And they're not gonna wanna give me a good rate or insurance at all.
Marie's fears are very real, and there are many young people out there who feel the exact same way. How can they possibly afford health insurance? But here's the deal. They just don't know what options are out there. Don't worry though, the Young Invincibles are here to save the day.
So we're a nonprofit, nonpartisan organization based in DC. We were founded in 2009, actually around healthcare reform. They felt that the young adult voices weren't really being represented in the debate around healthcare reform. So they ended up holding this campaign to bring young adults to the table. That's partly how you get to stay on your parents' health insurance until you turn 26, got wrapped into the law. And our organization was born out of that.
The Young Invincibles address multiple issues affecting young adults, those between the ages of 18 and 34, like access to health care, higher education, and youth unemployment and jobs.
Seem to resonate with young people are the mental health and substance abuse services, as well as prescription drug services.
Right now, they're working with nonprofits across the country to help get the word out about healthcare options for young adults available through the Affordable Care Act. We spoke with them on a recent trip to Missouri.
It's definitely a game changer. There's going to be so many more options that were never available previous to the ACA.
Some of those include comprehensive student health plans, coverage for pre-existing conditions, savings on monthly premiums and out-of-pocket costs, and no more yearly limits on coverage.
Anyone between about $15,000 a year and $46,000 a year in annual income will qualify for some sort of tax credit on the marketplace. So that really helps young adults, especially those with lower incomes or entry-level jobs, things like that, will probably be able to get affordable health care coverage on the marketplace. There are a few things that it does require.
Getting the word out. Well, these Young Invincibles have their work cut out for them.
It covers three.
Take Marie, for example. Remember, she's a college graduate who is concerned about the cost of health care.
Have you heard of the marketplace? Health insurance marketplace?
No.
I think that that's a big challenge is getting that education out there, spreading awareness. A lot of people just don't really know that these options are available. So making sure that they know that they have an affordable option, that they can go to healthcare.gov and see all of their options and pick an appropriate plan for them that's hopefully affordable is really the key.
You'll be happy to know then with the ACA that pre-existing conditions don't matter.
Very good. Good to me. Good for a lot of people.